If you struggle with nagging back or neck pain, you might assume that as the pain gets worse, you need more aggressive medical treatments, like spinal injections. But recent clinical guidelines issued a strong warning against that exact approach. The surprising part is what they recommend you do instead. But it is not just a generic stretching routine. Chronic spinal pain affects over 500 million people globally. It is one of the leading causes of physical disability. When we are in pain, we want a quick fix. But the transition from acute pain to chronic disability is complicated. It involves your nervous system, your habits, and your physical mechanics. So, if standard medical interventions aren't the answer, what is? Here is the hidden context. A recent practice guideline published by the American Academy of Family Physicians explicitly stated, "Do not use injections or radiofrequency to treat chronic cervical spine or low back pain." Furthermore, research published in the Swiss Medical Weekly highlighted that many doctors still prescribe imaging and strong opioids, even though guidelines say to avoid them for acute, non-specific back pain. Historically, patients were grouped into a non-specific pain category and given standard treatments. But contemporary medicine is shifting toward mechanism-based care. This means figuring out exactly which tissues are compressed or tight and tailoring the movement to the individual. For example, physical therapists note that lower back pain can sometimes be driven by tight hip flexors pulling on the pelvis. Neck pain is often exacerbated by mid-back stiffness from sitting in a rounded posture all day. The solution is often finding the specific mechanical movement that decompresses those exact joints. So, what can you safely learn from these physical therapy guidelines? Number 1. Explore gentle decompression. Elongating the spine can take pressure off the discs. This can be as simple as lying on your back with your knees bent and gently pushing your hands into your thighs to stretch the lower back. Number 2. Follow the pain-free direction rule. Physical therapists emphasize that if a stretch creates sharp pain, stop immediately. You should only perform movements that feel like a healthy, relieving stretch, both during the movement and the next day. Number 3. Counteract your daily posture. If you sit hunched forward, your mid-back gets stiff. Using a rolled-up towel behind your neck for gentle extension or doing simple chin tucks can help restore proper mechanics to your cervical spine. To summarize, healing your spine is rarely about finding a magic injection or taking strong medication. Modern clinical guidelines point away from invasive, quick fixes. Instead, the evidence supports staying active, finding the specific physical movements that decompress your spine, and avoiding positions that trigger sharp pain. The real secret is patient-centered, consistent movement. What is your go-to stretch when your back or neck feels stiff? Let me know in the comments below. If you found this helpful, please like and subscribe for more science-based health content.